So skin concerns. Okay, so a lot of the concerns will be just in the skin quality, the pores, the color, all those things. You have a lot of different options. One is some Fraxel, which is a laser treatment, Maximus, which is a radiofrequency treatment. The cosmeceuticals, you can use intense pulsed light, you can do chemical peels and facials, and again, they all add a different piece to the puzzle of correction. Fraxel is FDA approved for fine wrinkles around the eyes, for age spots, and for melasma and acne scars. Now, I use it as well for stretch marks. This is a lady who weighed about 100 pounds, had 4 children with significant stretch marks to just below the top of her bottom of her rib cage. And you can see after treatment a significant improvement. Can't get rid of them with stretch marks or scars. You can never get rid of the scar completely. But if you look at that, again, don't know how the lighting shows where you're sitting, but that's at least a 50% improvement in the scar. Once again, a realistic expectation. If a patient says, well, that's not good enough for me, I want them gone, then you would say, don't even start because you won't be happy. You really need to understand that's about as good as we can get. Acne scars, okay. Now, acne scars on brown skin are especially difficult to do because of the risk of hyperpigmentation. White skin is much easier to treat with lasers than dark skin. But again, I think that that's a fairly nice result compared to before. And this is 3 treatments of Fraxel. Yes, question? Do I use anything besides Fraxel for scars? Yes, I actually will inject Restylane underneath the scar to prop it up. We'll combine it with chemical peels. We use the Maximus radiofrequency. So a combination treatment will give you the best results. Yes? That would cost, well, it was a limited area. It wasn't a full face. If you're doing a full face, 3 treatments would cost $2,500. In that case, I think it was $900 because it was a small limited area. Okay. This is a surgical scar. It's a patient who'd had multiple reconstructive surgeries on the chest wall. And you can see this is a raised, angry-looking scar. That's 1 treatment of Fraxel. And it really flattened that scar out. So people coming in for gallbladder scars, C-section scars, hysterectomy scars, works very well. Women postpartum, helps to improve the stretch marks. Yes, question? Fraxel is a laser. Okay? The difference is that the term Fraxel comes from what we call fractionated laser. So if you think of standard laser as being a sheet of laser light, quote unquote burning the top, which is what people like to think of laser as, well, Fraxel is a bunch of little dots instead of a big sheet. So it's like aerating your lawn. You're not ripping off your whole lawn, you're just taking little plugs. This is 1 treatment on a bite to the face. And again, just 1 treatment, a pretty significant difference from just 1 treatment. It's a medical condition called poikiloderma, but a lot of women will get this chicken neck and redness on the neck, and 1 treatment of Fraxel will improve that as well. This is one of my assistant's hands. That's 1 treatment. Makes it a little less rough. Again, the lighting's a little bit different between the 2 pictures, so you can't really see it completely. But here's even just the outside of the hand compared to there, and you see that there's significantly less wrinkling of the hand. This is a combination. We did a little bit of Restylane, and we did a Fraxel, and you can get a sense that the acne scars are better. And again, you might not see it in this lighting, but he had all these little lines as well here, and they're significantly improved with just 1 treatment of Fraxel and 1 Restylane. Maximus is radiofrequency. Probably the first one that you may have heard of is something called Thermage. Then it went to Accent, then it went to So there's multiple radiofrequency devices out there. Maximus is now the 3rd generation. It's a tripolar. The science is a little bit beyond this discussion, but it is relatively painless. It gets heat into the skin to stimulate collagen production and synthesis and fibroblast activity. So it really helps to tighten up skin, and that's its major benefit. Also works for fat and cellulite, which we'll show you in a minute, but it really is probably the best thing we have for tightening up the lower half of the face, especially the neck and jowls. Usually you need about 6 sessions done once a week, and then maintenance about 3 or 4 times a year. So again, don't know how well this shows up where you're sitting, but You get an idea of here how wrinkly the neck is looking, and then that's after treatment. I believe this was 6 sessions. Same thing here. This is a man's jaw or a man's chin and neck, and you can see that this double chin underneath and the general appearance of the neck is significantly better with just a series of 6 sessions. This area drives people crazy, right? Underneath the eye, the bags, the looseness of skin. This is after 3 treatments, not a big difference. After 6 treatments, after 8 treatments, and again, anyone that wants to see these pictures in better lighting can talk to me after. I'll show you on the computer where it really shows up. But they're basically gone, completely gone. Concern about bat wings. Only treatment we had before that was surgical, and then you have a big long scar from your underarm down to your elbow. Not very appealing if you want to wear a sundress or an outfit that showed off your arms. And some patients get a very nice result with that as well. Fat and cellulite. Okay, you cannot get away from them. 80% of women will develop cellulite. It is a chronic disease. There is no one treatment that will work and work forever. Anyone that tells you otherwise is lying to you. And when we find the cure for it, it will be the holy grail of medicine, and everybody will love us. Okay, almost as good as the cure for cancer. So there is no substitute for diet and exercise. Certain people will notice a specific food will bother them, whether it's dairy, whether it's soy, whether it's tomatoes, whether it's gluten. Anything that inflames and irritates the body will irritate you at all levels. You forget that the skin is the largest organ in the body, and your general health and everything you put into your mouth is going to affect the skin. You cannot ingest whatever you want and not have it translate into your skin health, as well as your liver and your brain and your heart and your kidneys and your lungs. So, weight loss sounds like rocket science, but it's basically eat less and exercise. And there is no way around that one. Best way to keep weight off is exercise, because the body, believe it or not, will try to fatten you up again, and that's what drives people crazy. They work so hard, they lost the weight, they did a great job, and then they just find insidiously their body just wants to get fat again. And it's not your imagination. That's the way the brain chemistry works. We started as a nutrition weight loss clinic. We do executive weight loss now, but the brain wants to put the fat back on because it's a protective mechanism in the jungles of Africa. Problem is, we don't live in the jungles of Africa anymore. We live in North America where there's food in abundance, so that starvation and protection mechanism is no longer a benefit. Instead, it's a disadvantage. So the radio frequency, in the old days we used to use mesotherapy to inject directly into the fat to try and break it down. Now a much less invasive technique is the Maximus, and it uses the same device that we use for the face, but it also combines a little bit of muscle stimulation to try and improve large areas of the body, such as the belly. So we've improved these lines here. There's your after. Cellulite, again, if you want to see a better version of the pictures, just talk to me after. So you can see more cellulite here and significantly less just with 6 treatments of Maximus. Now, you cannot do 6 treatments of Maximus, get rid of your cellulite, and think that they're gone forever. It's just like you can't go to the gym 1 week, think you worked out, and you're done until 2020. There's always maintenance. You can't eat 1 meal and live 30 years off of it. The body needs maintenance in every aspect. Water, food, exercise. Same thing here, right? You see there compared to there. Stretch marks are better, the whole size of the abdomen as well here. Look at the wrinkling and dimpling going on compared to after. IPL, okay, any questions about Maximus or weight, fat, and cellulite? It's usually the most common one, but okay. Yes? Sorry, I can't hear you. Cellulite treatment, usually we do it in a package. So ordinarily an individual treatment is $400. If you do a package, depends on how large the area is, it'll be between $1,200 to $1,800 for a package of 6 sessions. So IPL has been around now for about 10 years. It's basically using a flash lamp, a light to zap things. And it works more on the surface as opposed to deeper lasers, which work to stimulate collagen. So it's used for age spots, little broken blood vessels on the face especially. It doesn't work as well for blood vessels on the legs. There's a very simple example. That's one treatment, right? People that come in with these little cherry spots all over their body, boom, gone. And that takes all of 5 seconds and it's gone for good. You will still develop new ones just because the body is always developing new ones. Cosmeceuticals, very useful. Vitamin C and E are chief components of the skin. Absolutely crucial, especially when you combine them with Fraxel or Raximus or any of the other procedures you're doing. Again, one thing is not better than the other. It's all a synergistic effect. For patients that have the hyperpigmentation, the melasma, the dark spots, whether it's from acne scars or pregnancy or a laser service gone bad, there's something called dermamalan, which is a combination of azelaic and kojic acids, and that works very nicely to improve the hyperpigmentation. Now, when it comes to hyperpigmentation, it's very important to understand that they are very, very stubborn to treatment, and the treatment does usually require ongoing maintenance. So you might use the cream daily at the beginning for a month, then after the first month you go down to every other day, every third day, maybe once a week, but you will still need to keep on it for a long term. Hair removal. Now, why is this in an anti-aging discussion? Because you got to get it before the hair goes gray. Once the hair goes gray, we cannot treat it. And what a lot of people don't realize is bikini hair also goes gray. And when you tell a woman, oh my God, my bikini hair is going to go gray? No. That's just not acceptable. Then they want to get it before the grays kick in, okay? Very important to deal with someone that knows how to use a laser. The unfortunate thing is, in Canada, there is no law as to who can buy a laser hair removal machine. Anyone can buy it. My kids can buy them. With no training, no education. They get a one-day course with the company, and they are allowed to use laser on patients. So it's very important to understand that the person doing the treatment needs to understand the physics and the science behind the machine. Once again, patients will often call the office and say, well, what laser hair machine do you have? And the answer to that is, it doesn't matter what laser hair machine we have. It's a matter of the person administering the treatment. So you can have the greatest machine on the planet and a person that doesn't understand how to use it, and they'll burn you. Or you can have a machine that's 5 years old and still works beautifully because the person knows how to use that machine. Now, there's not really a lot of dark-skinned individuals here, but there is one that's a little on the dark side. And I don't know if you can see that. This is what happens when you go to someone that doesn't know how to use their laser. This woman came to me, 26 years old, very attractive young lady, cannot wear a mini skirt anymore or shorts in public because she was permanently burned when she went for laser hair removal. So those black streaks are burn marks from the laser. And this gives you another idea, right? So those lines are permanent. She's had them for 3 years. We've tried to get rid of them, and unfortunately we can't. So dark skin especially is prone to burning with laser, more so than white skin, but even white skin can have permanent effects from laser that's not done properly. So that's why we put that in this section. So I tried to be fairly brief, but cover most of the topics. I don't know if you have any specific questions about anything I talked about or questions that popped into your mind as we've gone through the session. Any questions?